Hey everybody, Roger Perigo here at Perigo Chiropractic. I wanted to take a minute today to talk to you all about a condition that can be kind of confusing for some patients because it does tend to mimic sciatica. So what we'll be talking about today is actually called Piriformis Syndrome. Now a lot of times I'll have a patient come into the office and they'll think they have an intervertebral disc injury, a herniation, disc bulge, things like that, right? Because they're having, maybe pain in the low back or glute area, and they'll have radiating pain down the legs. But in a lot of cases, what they're actually dealing with is this piriformis syndrome. So you're talking about the difference between a disc injury versus a muscle tightness issue, right? Because what the piriformis muscle is a muscle in that gluteal area that goes from your tailbone out to your hip. And so what can happen is that muscle will get tight, and that sciatic nerve actually, in most people, goes either in front or behind of that muscle, but sometimes it actually splits right through the middle of the muscle. So when it gets tight, it can give you those symptoms of sciatica with pain, going down the back of the legs. So in those patients, a lot of times what you'll see is a pain referral like this, where they'll have a lot of pain near the tailbone, a lot of pain near the outside of the hip, and then sometimes, like I said, it'll radiate down the back of the leg there as well. Now, causes of that there's quite a few things, many of which chiropractic can be helpful for, but a lot of times what you'll see is an overuse issue, where maybe someone's been running a lot, or if they're sitting for prolonged periods of time. It could be a muscle weakness issue where the other glute muscles have become a little bit weak. So there's a few different things there that can cause that. Now, there is a good stretch that I like to give people. There's a lot of exercises that can be helpful for this, but there's one really helpful stretch that I like to give out. Really the nice thing is you can do it anywhere. So I'm going to show you that here real quick. I'm going to have to move the camera. So let's see. Yeah, so real easy to do. You can do it in your chair anywhere. You can sit in a meeting, at work, whatever. But basically, you're going to sit in a chair. Let's say the right side is the side giving you the issue. So what you would do is take your right leg and you're going to cross it over the left. And all you got to do is keep your chest up and lean forward. And I like to recommend people just to gently press down on that knee as you're doing that. And you should feel that stretch really well down in those areas where I just showed you on the picture up there. And I apologize for the artwork. I'm a chiropractor, not an artist. So, but anyway, so yeah, if you are having any of the pain in those areas I showed you, if you're having pain radiating down the leg, you might give that stretch a try, see if it's helpful for you. And if you're wondering if chiropractic could be helpful, feel free to give me a call, 402-627-8294. And remember, there's always convenient online booking available at perigochiro.com. I hope you all have a fantastic rest of your day, and we'll talk to you soon.